I'd like to say hello to everyone who's joining us for this webinar today that's pre-recorded. I'd like to thank Graeme from Prostate Cancer Foundation New Zealand, who is their CEO, who's joining for me, myself, Dr. Anna Lawrence, for a chat about the prostate and urinary incontinence. So we're going to have a wee chat, and hopefully we'll cover all the questions that you have about your incontinence as a male, and if not, you can always contact us at Continence New Zealand through our website, or ring us on our 0800 number, which is a free phone, so it's 0800 650 659. And we always have someone there who can help address your questions or lead you in the right pathway to get some care. So welcome, Graeme, and thank you for joining me today for this talk.
It's a pleasure. Thanks for having us.
It's great. I think it's a good collaboration so we can get the message out there about continence for men, which is a topic that's often quite taboo, and we don't often talk about it enough, I think, in the community in New Zealand.
Yeah, well, it is a real issue for guys with prostate cancer, particularly after their treatment. So this will be really helpful for many guys who are dealing with that.
Great. So I'll kick off by letting you ask me some questions, if that's all right, and then we'll go forth from there.
So just tell us a little bit about what is urinary incontinence in men. What does that mean? So
if you're to medically define urinary incontinence, it's the loss of any urine. So often I think in New Zealand we try and downplay our losses of urine, and we talk about having a little leakage or a little accident. We seldom sort of talk about it as a flooding or of our pants, and we certainly don't like to use the term, I have an urinary incontinence, so we don't use those terms very often. But to define it, any loss of urine once you're toilet trained as an adult is defined as urinary incontinence. So you might leak just a small amount every day to the point where you have to wear a pad. It's still considered incontinence. Or you might unfortunately be so wet that you have to wear pull-ups, and we still call this urinary incontinence. So as an older adult or an adult who's had toilet training who was continent at one stage in your life, and you start leaking urine, that's not a normal part of aging. It's not a normal part of a surgical outcome. It's considered urinary incontinence. So any leakage or accidents is considered incontinence.
And there's different sorts, right? Can you explain those?
Yeah, so there's multiple different types of incontinence, which is why we treat them in different ways and we manage them in different ways. But the three most common are stress incontinence, which is the one that you see a lot of advertising on TV with ladies or gentlemen who cough or sneeze and they leak their urine. So that's probably the most common that we see advertised, the most common that's spoken about. There's urge incontinence, which is when you feel like you've got to go to the toilet really suddenly, you can't defer it. You can feel quite nervous about going to the toilet if you can't get there in time, and often you end up leaking on the way to the toilet. That can be quite distressing for a lot of people too, because you feel like you've got control but you don't have control. And the last type, that's the third most common, is something called overflow incontinence, and that's when your bladder's just so full all the time that there's no more room for any more urine, and so you just drip continuously, like a broken faucet is my analogy that I use for that.
So for guys that were following their prostate cancer treatment, what's the main one that they would be dealing with?
So initially, for most men who've had a surgical intervention, they'll have stress urinary incontinence. So that is where the sphincter that sits below the prostate after the surgery is being either, it's just a bit bruised or sore because the nerves aren't communicating appropriately after the surgery, or the sphincter's been damaged in terms of the cancer was involved and had to come out, because ultimately we need to remove the cancer for good cancer control. And so those gentlemen will have stress incontinence. So that's the cough, sneeze, leak, and that includes things like swinging your golf club, that's enough to generate pressure so you leak, or mowing the lawns, that will make you leak, or even getting the washing out of the washing machine for some people, that's enough to make them leak. So it can be quite depressing because you want to just do normal activities, and every time you increase your movement around your core, you end up leaking urine.
Dealing with, what do they do about it? How do they get that checked out and come and see somebody like you to do that?
Yeah, so I think if any patients have any leakage at all, it's really important that they do seek care and get assessed. We do have a prevailing attitude that if you're a little bit wet in New Zealand, don't worry about it. But I think if you're bothered by it and it's bothering you, not your family, but it bothers you, you should seek some care. And I guess, how do you get that care? It's a really good question, and it's a really good way, like something we should talk about. So first and foremost, Continence New Zealand, we have a helpline. So if you're ever worried that you think, well, maybe this is normal for me, maybe this is something I don't need care for, you can ring us. We're always available, or we have an email you can email us to, and we'll reply confidentially. No one will know about it, so you don't need to be embarrassed or worried that, you know, the person down the road will hear about it. And we can point you in the right direction. But firstly, most patients should seek help from their general practitioners. In New Zealand, each district health board, so each public hospital will have continence nurses. Those continence nurses can be referred to by the general practitioner. Continence nurses can make an assessment in the home, help you with simple things like learning how to do your pelvic floor exercises if that's appropriate, make sure that you've got appropriate pads if you need those, but also point out to you that maybe you can get additional care. If you need additional care, most hospitals in New Zealand will have a specialist like myself who's trained in continence management, and your GP can refer you through to be seen for that. There's no reason that you cannot seek out a second opinion or an opinion from a specialist like myself, because that's what we're here for. We're trained in continence, we're interested in it, we're passionate about it, we want to see you.
What I find is that guys post prostate cancer, and it's usually surgery, and they've got some incontinence, and they just think that that's normal. They just, you know, it's just part of life for them. And they talk about, you know, the unfortunate side effects, but it doesn't have to be that way, does it?
No, and I think you're right. A lot of people will tolerate being wet for a really long time and not realising that we have some really good ways of managing that that are available to you in New Zealand. So I would say, yeah, it is part of the unfortunate control of cancer, but it doesn't need to be part of your life forever, and you should definitely seek care.
So what does treatment for it actually involve? You know, if a guy's concerned that he is wet and suddenly realises from hearing something like this that it's not normal, you know, what's the process they go through from here?
So the first thing is to get yourself and to see someone like myself who's interested. And so we would assess you. So you'd come in and meet, say, me, if you would live up in Auckland, and I would initially ask questions around, like, why, how are you wet, when are you wet? So we can work out a picture of how much it's bothering you, how many pads you might use, how it's interfering with your life, basically. Like, a lot of patients will manage their incontinence by things like not going anywhere new because they don't know where the toilet is, or if they go on a road trip, stopping at every single service station they know that has a clean toilet. And that's quite restricting for your life if you're doing that. And to get a good history, you want to know about those sorts of things, because that really gives you a picture of how horribly debilitating or limited their life has become by their incontinence. So once we've assessed them from a history point of view, we always examine our patients. We want to know what sort of scars they have. If their prostate is still there, we will want to know how big that prostate is. My next investigations I like to do, I like to get an ultrasound. Ultrasound lets me know if they're emptying their bladder properly. And if it looks like the simple things haven't worked, so they might need some surgical interventions, then we would do a study called urodynamic studies, which is a really awkward study for patients, but incredibly useful because it allows us to work out exactly why they're leaking, and it helps us tailor our management for every patient who comes through, so they don't get just sort of a one stop, everyone gets it.
And when you do surgical involved in that?
So it depends. So if someone does have stress incontinence, like you said, Graeme, a lot of gentlemen post their prostatectomies have that. That relates to the sphincter not being very good at coaptating or closing to keep urine in anymore. So what we try and do is reproduce the sphincter. So we have 2 options and up to 3 options available to us in New Zealand. For gentlemen who are not particularly wet, so there's sort of 2 pads a day that have been changed that are not sodden, we can offer them something called a sling. So this is a piece of material that's placed around where the sphincter used to be, and it lifts it up for them to try and create that closure of the sphincter. So when they're walking around, they've got something that holds it closed where the sphincter used to be, so then they stop leaking urine. If, however, they're a lot wetter than that, then we would look at something like the artificial urinary sphincter. which completely replaces the entire sphincteric unit. And that's been around since 1970, early 1970s, so it's a really good device. It's the gold standard for dealing with incontinence. And most gentlemen who have it placed are so pleased that they had it placed. It's a little tricky and it can be a little uncomfortable for a few weeks after the surgery, but once we've got it working properly, most gentlemen are really dry, and they can go from having sort of 12 pads a day or wearing 4 or 5 pull-ups a day down to one little just-in-case pad that's basically a liner. And it gives you so much freedom. It's just so much a better way to live life.
And those treatments are funded. So
Yeah.
there's no financial barrier for guys?
No, so they're all funded in New Zealand. So all DHBs have access to that care. So everyone should be able to be seen for that. Now, some DHBs may not have someone who is a continence specialist like myself, but we all have the access to be sent to other DHBs if that's not available, because there's ways to have funding transferred with you. And if you are post-prostatectomy, there's always the ACC Avenue in New Zealand as part of a treatment injury from the surgery. So, and that gives you the access to see pretty much any specialist you want to see, because ACC is very good at helping people restore their continence with the idea that then they'll have a better quality of life and then they'll be contributing back to the community.
Yep. So no exclusion with incontinence, right?
No, and often you see people and they've sort of had it for 10 years and someone's told them they shouldn't have any interventions because their surgery was really difficult, or there's all sorts of things that you hear. Basically, if you've had surgery for your prostate cancer and you're now a year out from that and you're still so wet that you're really bothered by that, you should seek care. You don't need to wait any longer. There isn't really a good reason for you not to at least start an assessment with someone who has continence specialist training.
Yeah, we had something the other day on our 0800 line just about this, and it was a wife actually, and the husband had been living with this sort of incontinence for nearly 20 years, and she was at a wit's end doing all the washing and things like that, and so, able to advise her accordingly, just like what you're saying. So it is a major issue for so many guys out there. But just sort of think right back, when guys are diagnosed and they start to, they know that this is a potential issue, what can they do ahead of treatment to try and minimise the risk of incontinence?
Yeah, so I think what you can do to minimise your risk of incontinence is a few things, and it's things that we could all do as a general population as well, is maintenance of a healthy weight, which is really easy to say, not so easy to do. Avoiding too many caffeinated products or carbonated products, decreasing your alcohol intake. So all of those things help with bladders that get irritable. But in terms of stress incontinence, particularly after surgery, pelvic floor exercises. So there's good research that supports pelvic floor exercises for men who are having prostate cancer treatments. And it's really, really important that people try and tap into that service before they have their surgical intervention, because after surgery, you're sore, you've got new wounds, it can be quite uncomfortable, and it can be really hard to find those muscles. So if you can see a physio before you have surgery, it's easier for you to start those exercises immediately after surgery, and then you do much better for it.
And it's important that training, make sure that you actually do those exercises correctly.
Absolutely. So all the research that goes on and on about pelvic floor exercises is with a physio who knows how to do it. And I can't speak to all the DHBs in the country, but in Auckland we have pelvic floor services, and we do try and get the patients across to the pelvic floor physios who are absolutely brilliant before they start having their surgery. And a good pelvic floor physio, honestly, worth their weight in gold for these patients in terms of finding those muscles, learning how to identify them, and getting them working again early after surgery.
And for some guys, it's not actually prostate cancer, but it's the old enlarged prostate, the BPH issue that they have, and that can cause urinary issues too. Any comments on that?
Yeah, so a lot of gentlemen, as they get a wee bit older, the prostate gets bigger, and as it gets bigger, classically speaking, it starts to block the outflow of your urine. So for a lot of men, they don't notice the flow dissipating, or it doesn't bother them because they've been told, oh, well, you're getting older, that's part of aging. What can happen, though, is if it gets too slow, the bladder starts to work really hard to try and push the urine out, and then it becomes dysfunctional, and then you can get that urge incontinence that we were talking about. So you end up going to the toilet often, and then when you do need to go, you're in a hurry to get there, and the bladder just seems to let go on the way there, and that can really be quite embarrassing and devastating in terms of quality of life. So again, not something you have to tolerate or put up with just because you've become older, because again, aging doesn't mean you become urinary incontinent for whatever reason, and I think that's one of the biggest myths in the community that would be really good if we could dispel, because it's not a normal part of aging. So most men who do have a big prostate and their bladder starting to cause problems, we'd start with trying to open up the prostate either with medicine or with surgical interventions, and then also address the bladder's behaviour with medicines or medications like Botox, which we put in there. So there's lots of really good ways to manage it. So again, you do not have to sit at home and tolerate that.
And that's because so many just live with this thing, as I said earlier, and they don't need to. And we really appreciate the work that you and others in your field do to help these guys, and we try and get that message out to them too. Great,
yeah. So I think if people don't take home any message other than that they should not tolerate being incontinent, if it bothers you, please seek help. And if you don't know how to seek help, then get in contact with us at Continence New Zealand, because that is what we're there for. We're a not-for-profit, and our whole goal is to help New Zealanders be less wet and be continent.
That's great.
Excellent.